Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to the Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're diving into something that affects every one of us, open enrollment season. It's that time of year when millions of Americans choose or renew their health insurance plans for the upcoming year. It sounds simple, right? But for people living with chronic conditions, it's anything but. Picking the wrong plan can mean the difference between getting your medications covered or facing thousands in unexpected out-of-pocket costs. So in this episode, we'll walk you through what open enrollment actually is, what's new for 2026, and how to make sure you're getting the coverage you need. Before we get started, I just want to say that today's episode is specifically about private health insurance plans, not Medicare, not Medicare Advantage, nor is it about Medicaid. So with that, let's get into it. So what is open enrollment? Every year, from November 1st through December 15th, people can buy or change health plans for the next year, whether through the federal marketplace at healthcare.gov, your state's Affordable Care Act exchange, or your employer. Think of it as the health insurance season. Once it's over, your choices are locked in until the next open enrollment period, unless you have a life event like getting married, moving, or losing coverage. The reason this window exists is to keep the system fair, so people don't wait until they get sick to buy insurance. Makes sense, right? So let's get into the basics, premiums, deductibles, and more. Health insurance has its own language and it can be confusing, so here's a quick refresher. First, premium. That's the amount you pay each month to keep your plan active. Deductible. That's what you pay out of pocket before your insurance starts covering costs. A copay, that is a flat fee for things like a doctor's visit or a prescription. Co-insurance, this is a percentage you pay after meeting your deductible. Out-of-pocket maximum, this is the most you'll pay in 1 year for covered services. For 2026, the maximum is $10,600 for individuals and $21,200 for families under federal law. After that, your insurance will cover everything at 100%. Knowing these numbers helps you compare plans. Sometimes a higher premium means lower overall costs if you use a lot of healthcare services. A big deal for patients managing chronic diseases. So what's new for 2026? Well, several changes are worth noting. 1. Essential health benefits like hospital care, prescription drugs, chronic disease management, and mental health remain mandatory for most plans. Plan types. You'll see HMOs, PPOs, and high-deductible health plans. The key difference is flexibility. HMOs tend to be cheaper but more restrictive on where you can visit a doctor. PPOs cost more but let you see specialists without referrals. Transparency improvements. Insurers are required to give clearer breakdowns of coverage, network, and out-of-pocket costs. But even with new rules, patients still face hurdles. Formulary changes, step therapy protocols that still exist, and copay accumulator programs can all limit access to necessary medications. So be wary when choosing a plan. When choosing your 2026 plan, be sure to ask key questions. Are my current doctors in-network in the plan that I want to select? Are my medications on the plan's formulary? And if so, on what tier in that formulary? Does my plan use step therapy or prior authorization for my condition? How might that impact my decision? Does a particular plan have a copay accumulator adjustment program? What are the premiums, deductibles, and out-of-pocket limits with each particular plan that you're considering? And here's something many people don't know. If your treatment or drug falls under an essential health benefit, your plan must cover it under federal law. You still pay cost sharing, but it cannot be excluded from the plan itself. For chronic illness patients, this is especially important. Understanding those protections can save you thousands of dollars. Affordable Care Act subsidies. This year's open enrollment comes amid a heated political debate. Congress is divided over restoring or cutting Affordable Care Act subsidies, the tax credits that help millions of Americans afford their coverage. As we have discussed on the podcast, this policy issue is the main sticking point in the current government shutdown. As a side note, we have now set a record for the longest federal government shutdown in U.S. history. If those subsidies expire or shrink, premiums could rise dramatically in 2026. That's why patient advocates, including GHLF, are pushing lawmakers to maintain and even expand affordability programs. We know what's at stake. People skipping medications, avoiding care, and worsening chronic conditions. If all this sounds overwhelming, don't worry, help is available. Visit healthcare.gov or in your state, go to your marketplace site. There are free navigators that can walk you through your options and talk to you about the specific issues raised in this podcast. Choosing a health plan isn't just about numbers, it's about protecting your health, your family, and your peace of mind. Take the time to compare plans, ask questions, advocate for yourself, because the more informed you are, the more empowered you'll be to make decisions that fit your needs. And remember, if something seems confusing, you're not alone. That's why we're here. Before we wrap up, a quick reminder, it's also not too late to get your seasonal flu or COVID-19 vaccines. In fact, it's almost the perfect time to do so. Staying up to date on these shots help protect you, your loved ones, and your community as we head into the colder months. To learn more about vaccine recommendations and find reliable resources for patients, visit ghlf.org/vaccines. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.